time to start rich discussions about the case that we have. So just to summarize this case, so you're a new attending at your new job. You just finished your residency where you were a minority, and you worked so hard during residency. You're a perfectionist, and when you get to your new job, you do a procedure that's hard, you get acknowledged for it, but then you still feel that it just happened because of luck. It's almost like that feeling that, oh, maybe I just got this one right, but the next one I'll get caught because I don't know what I'm doing. So let's get this question going. So has something like this ever happened to you, and how did you deal with it? Has anyone in the room ever experienced something like this?
Something happened a couple of months prior that wasn't the best outcome that I liked, and so I was having a hard time like getting over that. And then this procedure came in, and I had never done it before. There was a little girl that her trach got blocked, and you just need to take the trach out and put an ET tube in. I don't ever deal with trachs, and it was just an emergent situation where an attending handed me an ET tube and was like, "Get the trach out, put this in." And I was like, "Okay, we'll just see how this goes." And thankfully, everything worked out. But the discussion afterward with some of the other attendings, the more senior attendings, as well as our chair of the department about how badly that could have went, made me feel like, oh, I just got super lucky that this happened. And, oh, is the next time that this happens, am I going to be able to perform like I did? Am I going to be able to make those quick decisions with all of the other things that have happened? And so it took a while after talking to more people and actually looking up different research studies about like trach care and just making myself feel more confident that I was able to be like, okay, I kind of already knew what I was doing. I had never done it before, but it was just, I'm okay.
Yeah, thank you for sharing that story. That is something that is very common, right? We, no one, like you knew through your head, even though you have never done that procedure, you knew through your head more or less what the steps were, and you were prepared for that moment. But at that moment, it's very easy to say, oh, it just happened because of luck. And, maybe the other attending wouldn't have handed you the ET tube if they didn't see the confidence in you that maybe you weren't seeing in yourself at that moment.
And I think something else you mentioned too comes from our experience. Like if you think about like similar situations where you have had a bad outcome, that kind of also is in the back of your mind. So kind of overcoming those bad outcomes and remembering them, but thinking forward about also the good outcomes.
I think it's also important to normalize that sometimes when you make a mistake, I worry that it's not just me. So if you're underrepresented in medicine, you feel like you're representing a lot more than yourself, and so the cost is a lot more.
We feel like we're not only representing ourselves, but we're also representing everyone that looks like us, or everyone that belongs to the group where that we belong. And we don't want to make them look bad by making a mistake, right? More or less, that's a feeling that we sometimes get. But anyone want to share their story? Okay. So we can move on to the next question. What do you think caused the character in our case to feel that way? What are some risk factors that this specific attendee has?
Experience.
Right. Exactly. And that's what we were talking about earlier, especially during times of transition, right? We experienced this. We saw how fourth-year medical students feel that way, maybe on their sub-Is, their acting internships, when they're doing something that maybe they think they're not capable of. We experienced that during the first year of residency. We experienced that as new attendings. What else is in this case that maybe put this person at risk?
It sounds like this person is a little bit perfectionist as well. They have some underlying other things that are contributing to them not feeling the most like on their game. and also being an underrepresented minority, like in a new place, and not, it depends on, do people look like this person at this place? Can I ask questions and not seem like I don't know what I'm doing? So that might also contribute to that as well.
Exactly.
And we'll touch more on those, especially like the part of being a perfectionist, and as everyone here being in medicine, like there's some degree of that to some degree to have to get to where we are, the level of training we've overcome. So in the strategies part, we'll talk about ways that we can kind of engage that and just find ways to overcome that as well.
So I think we've had a great discussion so far about what imposter syndrome is. We've shared our stories, which is not easy to do, right? But let's move on to the next part, which is talking about what we can do as individuals, as peers, and as institutions. So if we take the example of the case that we just read, what do you think are some of the things that this individual can do in order to deal with this feeling of imposter syndrome? What is something that this person could have done, or that they can actively do, or prepare themselves for when they experience something like this?
Or it may even be something that you guys do on a regular basis to overcome imposter syndrome as well.
Remind yourself that you have about the same training and as everybody else, and the rest of those guys out there are feeling about the same way. Doesn't help much, but it helps a little.
Self-compassion.
So I think just knowledge about this imposter syndrome. So we've all felt this, but now you put it up there, it's for real. It's not just me who experiences this. So I think just even some education around it. By the way, you're going to experience this. Here's what it is. Kind of don't worry about it, but also here are some solutions to that.
Right, normalizing, realizing that we're not the only ones.
Find your tribe, I think, is like really important. So, like, I have 5 other attendings that I talk to probably every single day that probably know all the things that I am feeling in my head on a regular basis and can either justify or not, like whatever it is I'm thinking. As a resident, when I was an intern, we used to have regular sessions we called Wine and Wine, where you would whine about whatever it is you felt like you weren't doing right, or how things have been going, and everybody could commiserate and together feel their imposter syndrome, which I think made it feel a little bit more not only normal, but like, well, if everybody else is feeling that way, then I must be good.
Exactly, I like it. Find your tribe.
Yeah, sharing it and normalizing, right? And knowing that you're not the only person that is going through this or that is feeling that way. I think really helps.
Just to emphasize the sharing and making sure as leaders we let our junior folks know that we deal with the same thing. And if that means I say I don't know during a shift, or hey, I dealt with a similar situation, whatever it is, making sure everybody knows that we're all in this together and we've all been there.
Like storytelling, like being open about it. I think I saw a hand.
I think it's also really important to normalize the fact that we know that it's likely to be worse. Your imposter syndrome is likely to be worse at times of transition, and to realize that the feeling will hopefully likely lessen with time.
I'm writing down notes, by the way, so you have access to this later on, so you can take this home with you.
Oh, there's a couple more.
So the way I think is, if you have a success at any particular moment, enjoy that moment. Don't think too much about future, because sometimes it happens you set yourself for a very higher bar. Like if I did stellar job at this point of time, I have to deliver every single time in future too. But as in medicine or as a physician, you are going to make error in future. So error does not equate weakness or feeling of being ashamed or anything like that. So I think sharing, having a platform to open up all those things are important.
So I have this thing that I do with my daughter, who right now is 3, where I say to her, you know, who's my smart girl? And she says her name. Who's my beautiful girl? Who's my silly girl? But laying out these sort of positive attributes about herself that I want her to internalize. And I think as we sometimes, we have to be careful about the narratives that we tell ourselves in our head about ourselves. And when we find ourselves going down sort of the negative path about what we are telling ourselves about ourselves, we really have to be very conscious of that to steer it to a positive direction. Even if you don't even believe it, but just sometimes saying those words like, I did this procedure, I am capable, I am smart. And even just saying it out loud helps to buffer some of the negative things that we can internalize about ourselves.
So like focusing on the good things, focusing on the positives, and also recognizing that we do make mistakes, but that there's so many positive things and we're capable of doing. Okay. So I think we can move on to some of the strategies. And just to tell you up front, you've gone through most of this ones here in this group, which is great. It means that we've come up with like most of the strategies here in this group. So thank you for being so open. Thank you for participating. So just to summarize, since you've already touched on most of them, what can we do as individuals? And I think that self-compassion, the concept of self-compassion is probably the most important here, because we need to be kind to ourselves. If I can drive one thing on this workshop today, is that we need to be kind to ourselves, and we need to understand that it's just so easy for us to focus on our weaknesses, on the negative aspects of our daily jobs, and it's hard to recognize the positives and our skills that we bring to the table. The next one, keep learning. I think this is also very important because we're all trainees. We're all learning all the time. We'll never stop learning, right, in our careers. And I think it's sometimes very hard to put ourselves in the shoes of those above us, and we just think that they're just great at what they're doing, and I can never be like them, and maybe, you know, they must be so genius, and I'm here because they just needed this spot, and I don't deserve this. But we've all been there, like someone mentioned. Even the people that we look up to, they've been in our position as learners. Finding mentors is also very important. Finding that person that you can acknowledge these feelings and that you can have regular check-ins with. The next one is be a mentor. And I think we've recognized here the power of storytelling and how powerful that can be, because even though it's very hard to share your story, it will inspire other people. And it will inspire other people like you that are hoping to be in that position. So being that mentor to that person is going to be very important to yourself, but also to them. Now, what can we do with our peers? So some interpersonal strategies is having peer support programs. Like finding your crew and having regular check-ins, like someone mentioned. Having openness about the issues among peers. So I have a good example of this one too, similar to what you were talking about. After the first week of intern year, we all regathered and we sat at a table. And before our Wednesday conference, all the interns, we sat with our program director, and we just had a check-in about how it had gone the first week. And there was this silence in the room, and everyone had pale faces, and everyone just looked so scared. And no one wanted to open up the discussion, but as soon as the first person said, I feel so done, like I have no clue what I'm doing, I feel like I'm just an extra person, everyone just started like sharing their similar stories, and everyone had that same feeling, but no one was saying it. And believe me that after that day, it was so much easier to just, even now, you know, it's been a few months now of intern year, it's so easy to just walk up to any of my co-interns and just tell them, you know, I had a horrible shift the other day, I was feeling this way or this way, and we can normalize it, and it helps you as a person. And then similarly, having a supportive environment where we can share our ideas, we can be respectful of those thoughts, and we can grow from each other. And what can institutions make? And I think the most important thing that institutions can do is to recognize it, to give it a name. Because, like I mentioned earlier in my story, it is really easy to experience this, but it is not until you know that this is a concept and this is something that people are experiencing that you start to having more tools to deal with it, right? I wouldn't have known how to deal with it if I hadn't learned about it. And up until recently, I thought I was maybe the only person that was experiencing it until I realized that, like Nancy said, up to 70% of people experience imposter syndrome. So I think giving it a name is probably the most important thing here. Being authentic, giving your trainees authentic feedback and expectations that, hey, you're going to experience imposter syndrome and training is hard. So we need to have a support environment for everyone that is in our institution. Like I mentioned, the power of storytelling and how that can motivate other people and inspire others that are like you. And then lastly, the concept of diversity 3.0 that Dr. Gisondi mentioned earlier. It is empowering everyone, including those from underrepresented minorities, to be into those positions of leadership so that they can be the next face of our institutions. And lastly, I really want to emphasize that imposter syndrome is not uncommon. And I hope that you all leave, at the end of the day with thinking that it is, or that we can all recognize how hard it is to share our stories. But I really want to thank you for sharing your story here. I think this, it really opened up the discussion, and we're able to leave here with, having learned from each other our experience from imposter syndrome. And thank you so much for being here. I really hope you enjoyed our presentation.
Thank you.